So think of it this way. Stem cell is a blank slate of all your DNA, basically a replacement part.
It will find the areas of inflammation and go there to provide signals for healing.
I have a lot of friends, doctor friends, in fact, who don't believe in stem cells, which I think is crazy because there are thousands of studies out there that show the efficacy of stem cells. They show us that stem cells work.
I've seen things that, we were told were impossible when I was in medical school.
One of my patients came to see me with essentially no cartilage left in his knees. I did a stem cell injection for him into both knees. Now I believe he's one of the highest paid rugby players in the world.
In the largest orthopedic study using stem cells from fat tissue, 93% of the patients demonstrated improvement. There's no pharmaceutical or surgery on the planet that has this kind of response rate.
It is the most miraculous discovery of my lifetime, and I'm sure for everybody else's lifetime.
We actually are getting as close as possible to the fountain of youth.
And the beauty of it is that it's not even magic. It's your own body's ability to heal, and we're just cranking it up and telling it to go.
And I cannot wait until cutting and drugging is no longer the first option. Cellular medicine is the future.
It's almost like magic. I'm a surgeon, not a magician. But you know what? This is about as close as you get to the real trick.
I will tell you something about stem cell therapy that may surprise you. And there are a lot of questions that are asked about, what may be the best kind of treatments and what kind of cells to use. So I'm going to answer some of the questions for you. That people still have the idea, and even some doctors still think that when you use stem cells, you put in the body, you're counting on the cell's ability to become cells of the tissue that you're trying to repair. Unfortunately, that's kind of old school thought. Within the last 10, 15 years, it's been pretty evident. If you look at all the research studies, everyone is, accepting, okay, we used to think that's how the cells work, but now we know that's not how these stem cells work. They work by providing signals. So they don't work by going there saying, I'm going to become a liver cell or I'm going to become a muscle cell. They go there to send the right signals to your immune system, to tell your immune system what to do, to send the right immune cells to take away the cells you don't need, and to send signals to the local tissue so your local stem cells can start dividing and can start regenerating. So that's how you rebuild the new tissue. So it's really not so much about having to put the cells right where you need them so they can become the tissue you want them to become. This is why simple treatments like IV treatments can be so powerful, because the cells do have the homing mechanism. They can get to the areas they're needed. And even if they don't divide, sometimes they do, mesenchymal stem cells, they can become muscle cells, bone cartilage, or even neurons and liver cells. So that's been shown. But that's not what we're counting on. We're counting on their ability to talk to your whole body and to get to the areas that are needed and start talking to the local tissue. So that's why I think a lot of doctors are missing the opportunity to tell the body to come on board. So if you just inject into that area, then you're limiting your action to that area, unless the cells gets absorbed into the bloodstream, and then you start to talk with the whole body. And that's what happens a lot of times. So even if people think that I'm treating locally, sometimes you end up getting a systemic effect. Unless you're injecting to joint space, then it's in the joint. It's not going to get absorbed anywhere else. It's going to stay in the joint pretty much. So I think that's a missed opportunity for a lot of doctors, is not allowing the cells to talk to your entire system. And your immune organs can be very powerful at orchestrating the repair. So you want to take advantage of those capabilities of these stem cells.
Regenerative medicine and stem cell therapy, healing from within. Stem cell therapy, a field that uses the body's ability to heal and regenerate damaged tissues and organs, has the potential to revolutionize healthcare. Stem cells, including embryonic stem cells, SCS, adult stem cells, and induced pluripotent stem cells, IPSCs, can differentiate into various cell types, offering new treatment options for previously incurable conditions. Stem cell therapy is being explored for various medical conditions, including neurodegenerative diseases, heart disease, diabetes, and spinal cord injuries. However, challenges include the need for rigorous clinical trials, potential immune rejection, and ethical considerations surrounding embryonic stem cell. Advances in gene editing, tissue engineering, and stem cell biology are expected to drive